So I was in California for the first part of my career, but I've been here in Oregon for 30 years. And I was part of the beginning of the Oregon Health Plan and helped design the dental portion of that. It's been a great journey. And so again, let's move forward. There we go. Okay. So what I'm going to talk about really is SDF, silver diamine fluoride, and how this is a game changer in dentistry. For adult and pediatric cases, I'm going to talk about how it's been used in public health settings and some of the international programs that I've been involved with. I'll share that message with you. Some disclosures. First of all, yes, I'm a dentist and I own a dental practice. Shoreview Dental is a private practice in Kaiser, Oregon. And I'm also a partner in No DK, is that catchy? A medical device company. And I'm editor of a textbook, Smart Dentistry, which I won't go into much detail, but it is a resource. I want to mention our three main websites. SmartOralHealth.com is a website that focuses on the textbook and what it contains. It's a 500-page manuscript with authors from all over the world on this subject material that I've been putting together for like eight or 9 years. NODK is our medical device company, and again, you'll be able to see how that's being used around the world. And then lastly, the MMC library site. MMC stands for Medical Management of Caries Library. We've been collecting literature for many years now. It's a massive electronic library. We're continually adding to it. And so if you want to just go and browse the library like you would anywhere else, please visit. A couple of things to keep in mind as we go forward. Some of these concepts are relatively new. And some of my colleagues have never heard of what we're going to talk about. There also exists some knowledge gaps that we're waiting for answers. Research is being conducted both at the molecular level to the public health level. We must figure out how to build some bridges between the science that's being developed and the observations that we have. We always need to discuss the advantages and disadvantages of everything we do with our patients. And so I want to emphasize the importance of that, especially with something that is new. And I want to also announce there are many very high quality clinical trials that are underway to give us more information. I'd like to start out with a short presentation that was on PBS NewsHour that was about this. This ran about 4 years ago.
But first, there's long been a push to promote better dental health through fluoridation and telling people to eat less sugary foods. Despite those efforts, tooth decay remains a major public health issue. In fact, it is the most common chronic childhood disease, and 90% of all adults have cavities. As many of us know, traditional treatments can often be painful. But a new, pain-free, low-cost dental treatment could help all that. Special correspondent Kat Wise has the story. It's part of our breakthrough reporting for our weekly series about the leading edge of science and technology.
It's an unmistakable stomach-churning sound, the high-pitched whir of the dentist drill. For more than a century, it's been one of the main tools in the battle against tooth decay.
The standard drill and fill treatment is not a lot of fun for anyone. But for some patients, especially young children who often have to be sedated or put under, it can be very challenging and even dangerous. But the silvery liquid in this little bottle has started to lead to some big changes in the way some tooth decay is being treated.
We started in 2013 using this, and it's in 35 years, I have not seen anything that's worked as well. Hey, Marie.
Dr. Frank Mendoza is a pediatric dentist on the Warm Springs Indian Reservation in Central Oregon. He is one of a small but growing number of dentists who've begun using silver nitrate, a widely used liquid antimicrobial medical treatment, with fluoride varnish, a widely used dental product, to stop tooth decay. The treatment is for cavities which haven't reached the pulp of the tooth.
The silver kills the bacteria and stops new bacteria from growing. the fluoride remineralizes or hardens what's left. That hard material then can be used to, you can actually bond or stick a lot of filling material with that.
On a recent morning, 13-month-old Xavier Walulatum and his siblings paid a visit to Dr. Mendoza. Xavier has 8 teeth so far, and despite his family's best efforts to keep them healthy, 4 have cavities. 3 months ago, Dr. Mendoza began the first of several treatments. The cavities have been stopped, and as of now, no new ones have formed. The black spots on his teeth are actually the silver doing its job on the decay. The staining is the main drawback of the treatment, which has been used in other countries and which has been shown to be safe in studies.
We're good. Okay.
6-year-old Sylvia is also getting treatments,
Okay, so first of all, let's see how your teeth are looking.
and so far her cavities are under control too. But older brother Frederick, who developed cavities as a toddler before Dr. Mendoza began using silver in his practice, ended up under general anesthesia in the hospital. That's a common story for young children in Warm Springs and in tribal communities around the country, which have high rates of dental decay.
Over half of the kids went to the hospital up until we started this silver nitrate project 4 years ago. We've seen about half as many kids requiring OR treatment since then. And we've changed nothing other than add this to our program.
The dark spots can eventually be covered with tooth-colored material, and when the baby teeth fall out, the stains go away too.
Okay.
Mom Nancy Walulatum says she doesn't like the stains, but she believes the treatment has kept her younger children from having more invasive work done.
It's really fast. They just come in and go out and then we're done. I think that it's really helping them, preventing them to not go through surgery.
Preventing kids from being put under or sedated has become a priority in the dental world. The authors of a recent article in the journal Pediatrics wrote, an estimated 100 to 250,000 pediatric dental sedations are performed annually in the U.S., and they highlighted the case of a 4-year-old boy who died after sedation in his dentist's office. But they noted it's difficult to track adverse events or deaths because there's no mandated reporting. The article's authors joined an expanding group of dental experts, including the American Academy of Pediatric Dentistry, who say a treatment that combines silver and fluoride can be effective in appropriate cases. The formula, called silver diamine fluoride, or SDF, was cleared by the FDA last year for reducing sensitivities in teeth. But its so-called off-label use for stopping cavities is now its main use. The treatment is much cheaper than drilling, typically about $30 per visit. Some state Medicaid plans and an increasing number of private insurance providers are now covering it. But a lot of questions remain, including why SDF works only about 80% of the time.
It works on most cavities. The problem is it doesn't work on all cavities.
One of those on the front lines of SDF research is Dr. Jeremy Horst, a pediatric dentist and a postdoc fellow at the University of California, San Francisco. He and his colleagues are studying, among other things, the structural and chemical changes in teeth before and after they've been treated with silver products.
We completed a short-term study, which blew our minds. It didn't look like the bacteria changed very much at all. There were just dramatically less of them. So it decreased the infection dramatically. That was when it worked. So we need to look longer term, and we need to look at cavities that didn't stop. Are there certain bacteria that are making the infection, this cavity in the tooth, still grow?
Dr. Horst is also studying how often silver products need to be reapplied to be effective. And he's using extremely high-res x-rays of treated teeth to uncover how the silver and fluoride seen in red in this photo work their magic.
So this is a bit of a tooth that we've imaged. So the dark area is the cavity. The surprising thing is that the silver penetrates down into the inner part of the tooth pretty well as far as the cavity goes, or sometimes beyond, and reinforces it, strengthens it, increases its hardness.
That's a good thing.
That's a good thing. Teeth should be hard.
UCSF is teaching both pediatric and general dentistry students about SDF, but it's not universally taught or practiced around the country yet. There are others, though, who could benefit if the treatment spread. 61-year-old Kaiser, Oregon resident Robert Block had a stroke 12 years ago that made it difficult for him to care for himself and his teeth. Dental decay is a problem for many older adults, especially those in nursing homes where it can be tough to get dental care.
Hello, Robert. Hey, so good to see you again.
Block began getting treatments from a local dentist who was one of the first to try using silver more than a decade ago, Dr. Steve Duffin.
We just put silver compounds on all of his teeth, and I'll never forget, he came back 3 months later. I looked in his mouth, and he had no plaque on his teeth. His gums were healthy. He looked like a different person.
Dr. Duffin, who discovered in an old dental textbook that silver nitrate was actually used in this country for a time in the early 1900s, believes what was old is new again for everyone.
I personally believe that this is the appropriate treatment for every person who has tooth decay because it is the most effective way to treat the disease, regardless of income.
Are you going to school after this?
In Oregon, the treatment has been approved to be used by hygienists and qualified dental assistants. And Dr. Duffin says that could have a major impact on access to dental care. Back in Warm Springs, Dr. Mendoza says prevention of cavities should always be the focus. But when needed, silver is making a difference.
I won't ever go back to the same way of doing it. I don't think parents would allow me because they know that there's another way to do it. It's not a silver bullet. It's not going to stop everything. You need follow-up. You need to start it early.
Later this year, the American Dental Association plans to release a clinical practice guideline on all non-surgical approaches to cavities, including SDF. For the PBS NewsHour, I'm Kat Wise in Warm Springs, Oregon.
So, Robert, we've had the pleasure of having you be a patient in our practice for about 7 years now. You started coming to visit us in 2007. And so I would like you to tell me a little bit about your situation in 2007, how your health was, and how you were dealing with oral hygiene and brushing and flossing your teeth.
Well, it's hard for me to brush teeth because of the Parkinson twitch. But back in 2007, I was having a lot of cavities and pain in my teeth. And so I was constantly going in and getting cleaning and having that nitrate medicine put on. And now I don't have ever have any cavities, and the pain is totally gone.
Wow. So I remember we started treating your teeth with silver compounds in 2009, and we noticed a big change in the number of new cavities that you developed and the healthy condition of your gums, etc. And so I'm just wondering how you feel about that. Are you happy with this new situation?
Yes, I am.
Okay.
It's a way for people that have a difficulty in brushing and maintaining. It's another avenue of getting your teeth, the gums taken care of.
So, Robert, do you think that this method of treating tooth decay and improving gum health would be helpful for other people?
Yes, I do. It definitely will help them in a long way.
Okay. Is there any downside to this? Anything you didn't like about the treatment?
No. It's been all good experience.
So you think it's better to paint medicine on your teeth instead of get needles and drills and filling?
Oh, by all means.
Well, fantastic. Well, we're really happy that you're part of our family and our practice, and happy that you're doing better. Anything else you want to share with folks out there?
Just that you ought to give it a try. It's wonderful. It will definitely change your life.
So here's an image of some root caries that has been arrested. Anyone who's used SDF before is very aware of the dark color that happens. And 20 years ago, I would be doing crown lengthening and a new crown, And in this case, I just painted some medicine on there, and the patient was perfectly happy with the result. There's a lot of new literature about how SDF is helpful for seniors, not just with controlling caries and root caries especially, but in controlling gingivitis and periodontitis. And keep your eye out for new literature on this subject. This is a gentleman who was a patient in my practice, and as Parkinson's disease affected him, no longer could travel. And so my dental hygienist back there in the background and I went to his house, and we continued to treat him with SDF. And if you look at the radiograph, you can see that the caries was very advanced. And in the second molar, was almost into the pulp. But we were able just to floss in the SDF, and then we placed some GIC in there and stabilized this for this patient without ever having to take him into a dental office or give him a shot. It's a really remarkable case. There's, you can see the GIC that we just thumbed into the area that was arrested. So we're seeing some really important literature come out. This is a recent paper with the title, "The Use of Silver Diamine Fluoride in a Dental Practice." Generally speaks to all of the scenarios that you can run into. And these are authors from all around the world, from the British Medical Journal. And then here's an example of a paper on the prevention aspect. Patients who were being treated for caries were found to have much less cavities going forward after their cavities were treated. And so there is a preventive effect that is really important that we're trying to understand. I want to tell you a little bit about an event that happened in San Francisco in 2017. The IADR meeting was held in San Francisco that year. And so a group of, I'll call us the silver fanatics, you heard from Jeremy Horst earlier, he was there. We decided to hold a free sidewalk dental clinic. And so the day before the IADR meeting, we brought all our materials and set up a chair, and we invited anyone who thought they needed a dental exam to sit down and let us treat them. And so here we are, caring for a street person who had lots of tooth decay, and we place SDF on all of his cavities, and we also place GIC. And so I want you to see this. Where we are working. These are some remarkable scientists from all over the world. Okay, my son Marcus is here on the right-hand side and has been very much involved in developing this technology. Okay, and the next video is going to show how we mixed GIC with a bicycle on the sidewalk in San Francisco. And this is Jeremy Horst doing the work. I think that's his bicycle upside down. So we wanted to show that we could do all of this without electricity and literally anywhere. And then we went inside the conference center and we recorded the entire day presentation on SDF. This is where I encourage you to go to the MMC library. And this is one of the many recordings of events that talk about this subject. And so you can find it there if you want to learn more. In 2012, I wrote a paper about my findings in my practice in Oregon, and it was published in the Journal of the California Dental Association, and it began to get some attention. We had identified that we had dramatically reduced the number of sedations and OR cases that we were doing, and unbeknownst to me, the journal made its way to Ecuador, and we received a call in 2013 from the Ministry of Health in Ecuador asking if they could come and observe treatment in our office. And so 3 dentists from Ecuador came and visited Shoreview Dental in Kaiser. And at the end of that visit, they invited us to go to Ecuador with them and conduct a large school-based clinical trial in Ecuador, which we did in 2013. Here's some images of the school and chairs that we turned into dental operatories. Now, in this case, we had the chance to train the Ecuadorian dentists exactly in the protocol for preparing the teeth, applying the silver compound and the fluoride, etc. And so we had very good results from this. Here again are some more images. This is the head dentist of the Ecuador Ministry of Health. Some of the kids at the school up in the mountains, almost 14,000 feet in Ecuador. Amazing experience. This is my dental hygienist, John Lee Potter. She went along with us to Ecuador. And we also worked in a school for special needs children. And here's Marcus with a friend from the school. And here's a dentist who is applying silver compounds and fluoride to disabled children in the school. He does have the benefit of having some electricity. This whole treatment takes about a minute and a half. It's amazing. So I'd like to just play for you the 5-minute interview with one of our associates who helped us travel in Ecuador and the dentist that worked in the school. And this is the headmaster, the director of the school. And we do have English language translation.
Buenos días. Estamos aquí en el Instituto de Educación Especial de Ibarra con la señora directora.
Yolanda
Cadena y el doctor Felipe Herrera, que nos ha estado colaborando durante el tiempo de todo este pequeño plan piloto que hemos hecho aquí en Ibarra. Quisiera preguntarle cuál ha sido su impresión del tratamiento con los niños, cómo les ha visto reaccionar. Este es un nuevo método que estamos tratando de introducir, esta metodología, ya que es atraumática, se puede atenderlos con un poco más de rapidez y hemos tratado de integrarle a nuestro medio.
En primer lugar, quiero agradecer al doctor que ha tenido la amabilidad de hacernos el contacto con este prestigioso grupo de médicos, de especialistas para el tratamiento a nuestros chicos, ¿no? Que son niños y jóvenes de escasos recursos económicos, y a eso pues se suma su discapacidad intelectual. Contestando a su pregunta, pues yo realmente la parte técnica no entiendo, pero yo estoy convencida que este tratamiento que les dieron a los niños pues les ha servido de mucho para su salud mental, y pedimos que esto sea un programa que esté siempre periódicamente a beneficio de nuestros niños. Y agradecerles muchísimo por esa atención y esa responsabilidad con la que ustedes siempre han venido a atender a nuestros chicos.
Muchas gracias. Muchas gracias. Es nuestra intención a colaborarles de la mejor manera y con una forma que es un poquito diferente y a lo mejor apropiada para este tipo de... Para eso le quería preguntar al doctor Felipe cuál ha sido su experiencia con lo que hemos pasado un año casi.
Sí, un año. He visto que es un método bastante efectivo para poder solucionar en parte los problemas de caries dental que tienen nuestros niños, ¿no? En este caso, nosotros que trabajamos con los niños con discapacidad, ellos son bastante renuentes al tratamiento odontológico, ¿no? Y generalmente el nuestro, con base a lo tradicional, con la turbina para poner restauraciones, es un poquito traumático para ellos y tienen un poco de miedo al dolor. Y como no alcanzan a captar o a entender lo que uno se quiere hacer, entonces este método nos viene a aliviar este problema.
Correcto.
Entonces nos cura momentáneamente o nos cura durante mucho tiempo las caries, ¿no? Y nos puede ayudar a prevenir mayores problemas hasta nosotros poderles intervenir dentro del tratamiento ambulatorio en el consultorio. De todas maneras vemos que los niños van perdiendo esa timidez, van aceptando un poco más el tratamiento cada día y van perdiendo el miedo. Lo importante es perder el miedo para que uno pueda hacer un tratamiento efectivo en
Así es. Correcto, ese es el objetivo nuestro, poder demostrar que este método puede ser aplicado de una manera fácil, rápida y efectiva. Sin dolor.
Sí, especialmente en nuestros casos con los pacientes con discapacidad.
Así es.
Porque nosotros también en el consultorio manejamos lo que le comentaba hace un momento, manejamos pacientes que han sufrido infarto cerebral, tienen problemas de trombosis, todo eso que ha llevado a la inutilidad en sus brazos para poder hacer una higiene normal dentro de sus dientes, ¿no? Entonces, en estas personas también he visto que este puede ser un tratamiento alternativo para evitar que sus piezas vayan a seguir siendo destruidas por el proceso carioso. Ya son pacientes que tienen una gran cantidad de gingivitis, una enfermedad periodontal bastante elevada, ¿no? Y unas caries a nivel de raíz son bastante destructivas y a veces toca extraer las piezas por ese motivo. Entonces he visto que parte de este tratamiento puede ir muy bien también en ellos,
Así es.
para limitar la extracción de piezas dentarias.
Perfecto. Hemos pasado prácticamente un año. Aquí hemos venido en a los diferentes meses, a los 3 meses, 6 meses y al año, y hemos visto que están las piezas, las caries están detenidas.
Sí,
¿no es cierto? Sí.
se han detenido.
Eso ha sido lo importante. Bueno, muchísimas gracias. Muchísimas gracias, Felipe, y estamos a las
ustedes, muchísimas gracias.
También muchísimas gracias a ustedes también por la iniciativa en tratar de hacer conocer este procedimiento, ¿no? De fomentar políticamente para que puedan aceptarnos a nivel del ministerio y en cualquier momento ya hacer uso de esta medida como curativa y preventiva en nuestros pacientes.
Así es. Muchas gracias.
Gracias.
So one of the things that was really surprising to me was the level of disease in Ecuador. These children had decay in almost all their teeth, very severe. They were suffering from pain every day. And so the results that we saw after 1 year in Ecuador were astonishing. In 2015, we received an invitation to go to Ghana. And it was explained to us that there are almost no dentists in Ghana. 1 dentist per 130,000 people in the country. And so our host suggested that we would be needed. And so we packed up and we went off to Ghana to treat another school of children. Pay attention to how many children pile out of this school bus. Amazing experience in Ghana. Children are just beautiful, marvelous. We took took a lot of care to document what we found. We had the good fortune of having a Ghanaian dentist who trained at the University of Michigan and practiced dentistry in Detroit for 20 years to join us in Ghana for this particular pilot. Here's a little video showing how we're applying the silver and fluoride in the anterior teeth of 1 young child.
Because I noticed not all
Just
of them.
genetic.
Okay.
There's just more melanin.
Oh, you want it less?
Skin.
You know, do that. You're gonna start.
Yeah, you're gonna start
I
something.
don't do it, Marcus. I did that the other day, and then it was chaos.
Sorry. It's new Tiffany.
Because I noticed not all.
So what you were seeing is an early prototype of a device meant to apply the silver and then follow it with fluoride varnish right away. It has gone through several iterations. We had a dental student from UC San Francisco join us in Ghana, and she collected saliva samples from the children so that we could identify the bacteria that were in the mouths of these children before and after treatment. This on the left is Veronica Sada. She's the owner of the school, just a wonderful woman. And on the right is the paramount chief of the area of Ghana where we were at. And we had to get a special type of permission. It wasn't enough to get parental permission. In the Ministry of Health, we did all of those things, but this is a tribal region, and we had to appear before the paramount chief and present our proposal to him before we could work with the children in the school. Amazing cultural experience for everyone. And we had to say goodbye to these wonderful children, and I look forward to the day that I can return to Ghana. We did go back at 6 months and 12 months to look at the outcomes of the data that we collected. Here are some children in tribal outfits, just beautiful. In 2017, we were invited to go back to South America, to Bolivia, to the Altiplano area, which is where Lake Titicaca is and the Andes, very high altitude. We treated almost 5,000 children. And we collected data on the amount of disease that they had, and we went back to look at the outcomes on this large group of children. By the way, it was very cold at 14,000 feet in the Andes Mountains. These photographs show what I'm talking about in terms of the severity of the disease in South America. Bolivia is probably a little bit worse than Ecuador. It's really astonishing. You can go to the MMC library and you can see about a 15-minute discussion from 2 Bolivian dentists that participated in this program. I'm going to pass it by because we really don't have the time, but I mean to show that we collaborated with Bolivian officials, Bolivian dentists, and this is why our programs were so successful. In 2017, I went back to another part of Bolivia, near Cochabamba and the Chapari region, to treat another school of children. And I'll talk with you about this group because they are headed by a dental hygienist, who's an important part of this whole story. This is a dental hygienist from the Seattle area, and she's part of what are called the tooth fairies from Seattle. And these are dental hygienists, and they have special outfits, as you can see, who go to schools and to long-term care centers, and they provide dental hygiene services to people throughout the Seattle area. And they came with us to Cochabamba. This is Sandy Kemper. She's the founder of the Smiles Forever Foundation. This is an organization that introduced the dental hygiene profession to Bolivia many years ago. And she started a technical college in Bolivia to train dental hygienists. And she has just done amazing work in Bolivia. And in 2018, she was given the World of Children Healthcare Award for 2018, which is an enormously prestigious global recognition for the work that she did. Sandy happens to be the first person to bring SDF to Bolivia. The previous events that we had done in Ecuador and Bolivia were with silver nitrate and fluoride varnish because SDF was not FDA approved yet. And now SDF was, and so Sandy brought some to Bolivia, and then she invited me to come down to see if they were doing it right and what the outcome was. And so we have dental hygienists from Seattle area and dental hygienists that were trained in Bolivia working together, treating patients. We're also collecting nutrition and health data. Took very careful notes of the progression of the disease or lack of progression, preventive effect, some of the most beautiful children I've ever met. This shows, again, a little closer view of the application of SDF and fluoride varnish by a Bolivian dentist who works with the Smiles Forever Foundation, Dr. Naida. Again, this is an early prototype of the delivery system to treat with SDF and fluoride varnish. And here we are with the Happy Kids. This school in the Chapari area of Bolivia had almost 600 children that we treated. We were able to treat them all in a matter of a few days. It was really amazing. The kids loved it. We provided a lot of oral hygiene, nutrition information, a fully comprehensive program, not just stopping the tooth decay, but teaching the children and their parents how to eat better, how to prevent future tooth decay. We collected a very nice data set over 2 years, which we finished in April of 2019, looking at the outcome of this intervention with this school. And then just recently, November of the year 2000, we published the actual data from the project in Ecuador, Ghana, and Bolivia at a very detailed level. This was published in the Journal of Public Health International. And I really encourage you all to read this paper when you get a chance. Now, these images show what the typical mouth looked like of children in Ecuador. The upper left image was a child in Ecuador. Almost all the teeth are decayed. This child is in pain every day. The middle image is a picture of a child from Ghana. Almost no decay. This was a surprising finding. And then on the right, this is a child from Bolivia. All the teeth are decayed. We found dramatic differences in the severity, in the prevalence of tooth decay in South America and Africa. This remains to be explored and questions answered. The lower image is a tooth with advanced tooth decay with arrest. Notice how the lesions are all black and hard. That doesn't look very pretty, but realize these are primary molars that are simply holding space for the permanent premolars to come in. If patients asked to have tooth colored restorations, we could do that. The vast majority of children in these developing countries did not request fillings. Okay, this is a brief video that I'm sharing with you. It's of me treating my grandson, who I'm sorry to say had a cavity. I guess I didn't take all the candy away. But anyway, this shows how we were applying the SDF and fluoride varnish in the office. And then the next video will show you how we put glass ionomer cement in the cavity afterwards. Okay, this is Jackson, and he has a cavity in the lower primary molar, which has been treated with silver diamine fluoride. We're going to do another treatment today. We begin by isolating with cotton rolls on the lingual and the buccal. We're also going to dry the lesion by applying compressed air to the lesion underneath a gauze 2x2 to prevent aerosols. I'm going to remove the 2x2, open the apply settings. We're now going to apply with one click the silver diamine fluoride and scrub it in the lesion. And then we're going to cover the fluoride varnish on the second device. Yeah. Okay, perfect. Okay, this is Jackson a couple of weeks later after the lesion is completely arrested, and we want to fill the cavitation. It has been treated 3 times with silver diamine fluoride. We're now going to prepare it for a smart glass ionomer filling. First step is to apply polyacrylic acid to get rid of the enamel pellicle, which we are doing. And then we will rinse that off with a 2x2. We're going to be placing Petria forte into this lesion. We have a nice separator in place. Starting from the bottom of the lesion up. Take about 2 minutes to set up. As we look at this image of the restored primary molar that was treated with silver diamine fluoride and then the cavitation filled with glass ionomer cement, I'd like to make note of a few things. Number one, it's pretty clear that there's a dark halo around the glass ionomer restoration. This is in fact silver ion that is present due to the treatment with silver diamine fluoride. In this case, the silver ion will protect the restoration from invasion of future bacteria and strengthens the overall treatment. So the presence of silver followed by glass ionomer cement has resulted in a strong functional restoration, which will last until this tooth exfoliates in a couple of years. If this were an anterior tooth, where the dark margin would be of concern, I would have taken some time to remove the dark silver stain at the margins of the restoration prior to placement of the glass ionomer cement. Thank you. So let me just mention the protocol. You can see that we dry the lesion, place the silver ion compound, either silver nitrate or silver diamine fluoride, and cover with varnish. What I've found over the years is that the placement of varnish prevents saliva contamination. And the biggest reason that I had failures that Dr. Horst talked about before was because I don't think the silver ion had time to diffuse into the lesion and kill the bacteria that were present. And so when I started using fluoride varnish, it wasn't to add more fluoride. There's lots of fluoride in SDF, but to act as a barrier between the treated surface of the tooth and saliva. I want to talk a little bit about a visit that Sandy Kemper, that you met earlier, the founder of the Smiles Forever Foundation in Seattle, came down to visit me at Shoreview Dental. By the way, the view on the left is what all of our patients see outside of our dental operatories. So it's a really lovely dental practice. She brought her 2 children down to my office to be examined together and to treat them. And then I did a little interview with her. So Sandy, welcome to Shoreview and thank you for coming to visit with us. And hopefully you can tell us a little bit about your journey and these 2 wonderful children that you have with you.
I have my children with me today. They're both from Bolivia. They are both 12 years old and 6 months apart. This is Giselle and Andre Aranibar. And I met Dr. Duffin through a co-project that we've been working on with silver diamine fluoride in the Chapare, which is a region outside of Cochabamba in Bolivia. In that rural community, we've been using SDF for 3 years and have found excellent results. So I've been using it on my kids at home. Hasn't it been fun?
It was fun.
Yeah, it was really fun. Huh? Wasn't it fun? So anyway, it's been really great. I've been doing it by myself without an assistant, without suction, without air at home, and have found great results. I wasn't sure how good they were. So I journeyed down today to visit Dr. Duffin's office, which is fantastic, a pedo office down here in Oregon. And I was hoping, well, I wasn't hoping that they were going to have decay, but if they did have decay, that we would fill those with smart fillings, GIC. Because there's not anybody that I can find in Washington State that is doing that. I didn't want my kids to have anesthetic, right? Yeah, and the drill, did you want to have anesthetic or the drill? No, and they didn't want to do that. And they're getting prepared for braces. So we wanted to make sure that all the decay was arrested. And I was concerned because I was doing it home alone. And it's been perfect. You know, they have some staining. Andre has some staining on the lower linguals where he has some demineralization, but we're really excited because he's going to be going into braces, and that would be a big cause to have caries. So they had some beginning caries that's been arrested, and we're super happy. Aren't you guys glad that you didn't have to have an injection? Yeah.
Well done, Mom. Treating cavities with medicine. That's what the future's all about.
Yeah. So Dr. Duffin and I are embarked on a journey of getting this worldwide. We're super excited. I'm so happy that my family's been able to participate, and we're just excited and happy to share. And if you want to learn more about SDF, please pick up a copy of Smart Oral Health. It's on Amazon. It has stories of people that have gone around the world, other clinicians, and are using SDF. This is going to be the magic bullet for people in rural communities and for stopping decay in areas, developing countries, areas where they have little or no access to dental care.
Well, thank you, Sandy. Your example is just amazing.
Thank you, Doctor.
So this is another recent paper that was published in the British Medical Journal, Managing Dental Caries Against a Backdrop of COVID-19. So now the attention has focused on how do we manage aerosols? How do we continue to practice dentistry in this new COVID world? And what has been noticed is that using the medical management of tooth decay, managing and treating tooth decay with SDF minimizes the aerosol generation, and it's really part of our future. So I'm glad to see that come together. And notice that Jeremy Horst is one of the authors in this as well. I'd like to share this little interview with my office manager about our journey at Shoreview Dental. So Tiffany, it's so great to be with you here today at Shoreview Clinic. How many years together have we been working in the dental field?
Since 1997. So it's been a while.
So you started out as my dental assistant and became an office manager. You've gone with me to Africa and South America.
Yes.
And we've treated lots of patients with every imaginable problem in dentistry. And my recollection in the early days of this clinic is we were overwhelmed with young children with severe dental needs.
Correct.
And so we were really struggling to provide appropriate care for all those children, and using what I was trained to do and thought was right. And basically for a child that was high need and uncooperative, we had either restraining the child while we treated them, or sedating the child, or going to the hospital with general anesthesia.
Yes.
And we did a lot of those cases, didn't we?
We did.
Hundreds, if not thousands.
Yes, we did.
Of them. And, you know, I want to talk with you a little bit about the papoose board and the restraint. And I feel that we always included parents in the discussion. We provided care with anesthesia and as compassionate care as possible. But nonetheless, the emotions of restraining a child to fix their teeth was challenging.
Yes.
And I would like you to take a moment and just say how you felt as a dental assistant doing your job. And I know that you were a new mom at this same time. How did that make you feel?
So it was always a challenge to watch a mom have to hold her child down while she's crying, the child's crying. And I don't know if you ever knew it or not, but I was crying under my mask trying to keep it together, because as a mom with a young child at that time, really tugs at your heartstrings, and you feel for that parent and that child that is being restrained in a papoose board first thing in the morning, and being restrained to do this treatment that they desperately need because they've got abscesses or big holes in their teeth and they're having a lot of pain. So, it was necessary at that time to do that treatment, but it was, very traumatic for all of us in the room.
So we did that for several years, a number of years, and then I was in a dental education course where I learned about a medicine that had been invented in Japan to stop tooth decay. And so we requested a bottle be sent to us.
Yeah.
And
It
so
looked a little bit like this.
there we go. So we got a bottle of Safaride, and I didn't know anything about it. So I had to study everything I could, and I was very nervous. So it sat on my desk for maybe 6 months, if you remember.
Yeah.
Until I finally got the courage to try it out on a simple case. And what I found was just astonishing.
Yeah. And honestly, I was a little skeptical as well. I thought, okay, well, if that's what he wants to do, but then we saw those great results.
Yeah. So what I started out doing was just putting silver fluoride on the teeth of children scheduled to go to the hospital, because I wanted to put the fires out and see if we could prevent them from having abscesses while we were waiting to go to the OR. But what was so surprising to me is when we got to the hospital, the child was under general anesthesia, and we were treating these teeth that were arrested. We didn't have abscesses, and the decay had not progressed.
And when we took the x-ray and we saw that secondary dentin laid down, we knew we were onto something.
Clearly, it was a remarkable finding. And so as we began to use this more in our practice, then what happened to the number of hospital cases?
They just diminished. It was amazing.
They slowly
Absolutely
just went
amazing.
away.
Yeah.
And
we
so,
were, I think at one point we were scheduled out 8 months.
Yeah.
It was an 8-month wait to get in.
It was just crazy. I felt so sorry for all of these children waiting because they had pain. We were treating with antibiotics or periodically extracting an abscessed tooth. Yep. And it didn't seem like we could stop it, but this medicine seemed to just stop the progression of the disease. It made it easier for us to treat them in the OR. And then I noticed it went from 8 months to 6 months to 4 months, and to the point, maybe after a year of using this material, we questioned the need to even go to the OR.
Right.
And so in our practice here in Kaiser, Oregon, it's been a little while since we've been to the OR. How long would you say?
Gosh, 10 years?
10 years. Okay, and we're still seeing lots of children.
Every day.
And the practice is actually bigger than it was then, but we're able to do it in an atraumatic, simple way using medicine. And I'm really grateful that this came into our lives. I'm grateful that you were willing to have faith in me and to do this. And I think we're all in a better place now.
I think so too.
So is there anything you want to tell the rest of the world about your experience and encourage them? Trade this for this?
Yeah, definitely. This thing is a monster. Nobody wants to put their kid in this papoose board and sit on their hands and hold their head. And no, this is much easier. You do this with a child. It's simple, safe, easy. Give them a sticker at the end and you're best friends. You put them in this, you're not best friends.
So is there any downside to this?
I can't think of any.
So what I understand is that a cavity, which is dark when it is diagnosed, becomes darker.
Yes.
Right? So a cavity becomes darker because of the silver, but it doesn't grow.
Correct.
And if it's in the front of the mouth or in some other area and we want to cover that up, we can do it with glass ionomer cements.
Yeah.
So it hasn't stopped the need to place fillings. We can just do fillings without anesthesia because this desensitizes the tooth.
Correct.
And without lots of drilling because we can now bond glass ionomer cement right on top.
Correct.
Leaving the silver inside the tooth to protect it.
Correct. Yep.
So this is just a smarter way to do dentistry, isn't it?
Absolutely.
Thank you, Tiffany.
Yeah, thank you.
So I'm here with Susanna and her two children, and she's going to tell us a story about dental work with the daughter and her son.
So my daughter's here. She's 11. She had a lot of dental work when she was younger, though. She had so many cavities where she had to go into the dentist's office more than a few times. And so she was really scared. She was crying and yelling. She had to get drills and needles and put to sleep because she cried and screamed so much while the dentist was doing her work. And I really like the idea of my son's experience now with the no shots, no needles, no drills. He's a little bit more, he's really more happier to come to the dentist's office than when I experienced with her. She didn't even want to go to the dentist's office, and I would have to bribe her and buy her things just to get her to go. And so I like the idea that when he comes, he doesn't even scream or yell. He just comes in, we leave, he gets a sticker.
Do you want me a toy too?
He goes out really happy. So the experience that I have with him is a lot better than when I had with my daughter.
Wonderful. We're very happy that you came to see us. Do you think other families would be interested in this approach as well?
Yeah, I think it's a great idea. I'm already telling my friends and family about it, and I love the idea where he gets out, he walks out really happy.
Terrific. Thank you so much for sharing your message. Well, that's the end of my story. And there's one less papoose board in the world. And if you look very closely at these two little girls from the Chapari in Bolivia, you'll notice there's a little dark spot on the front tooth of one of them. And that tooth was treated a year earlier. And the child and the parent didn't choose for us to place a GIC on top of that. And they understand that that is a baby tooth. It's going to come out. And if we had not placed SDF on it, it would probably be advanced to the pulp and requiring an extraction now. So anyway, they said it was a beauty mark. So anyway, I'm happy to share all of these adventures with you. Encourage you to pursue more information and explore ways to introduce this new method of treating tooth decay to your patients. And so I'm now going to stop sharing and we'll start a Q&A period. Okay, did that
Dr.
It's over, all right. Yeah.
Dr. Guffin, I have a question from one of the hygienists that's watching via FaceTime. She wanted to know, like in a typical setting, not in like Bolivia and Ecuador, but like your setting, is it multiple times that you administer it before you do the glass ionomer, or is it a one-time application?
Thank you. So excellent question. And I don't mean to give the message that we do something differently in Africa or South America. We are doing the exact same thing in Oregon. And that is basically if we identify caries, we put SDF on it immediately. That's the first thing I do. I don't bring them back. I place SDF at the exam. And then we cover with varnish, as I explained, to isolate that from saliva contamination. We have the patient back at least one more time or two times, depending on the size of the lesion. I want to be able to see that the lesion is hard, black, and it's ready to place the GIC. So we have a couple of visits at least, and then the GIC in that order.
Okay, thank you.
Sure.
I have a couple questions. That was a wonderful presentation, by the way. I really enjoyed it.
Thank you very much.
I have applied the SDF before, and up until tonight, I didn't know about the fluoride. So what it looked like to me is you apply the SDF and you don't rinse. You apply the fluoride varnish right away. Is that correct?
Excellent question. And I know that there are some other people have suggested apply the SDF and rinse it off. I just disagree with that entirely, just from my understanding of physics and chemistry. You know, it's the silver ion that kills bacteria. We want the silver to stay on or in the tooth. The silver does bind to demineralized tooth structure, okay? And so if I put SDF on the tooth and then rinse it right away, the silver leaves. So I dry real well, I apply it liberally, and then I cover with fluoride varnish right away for that purpose.
So you dry in between then? So you're applying the SDF, drying, then doing the fluoride varnish?
You're immediately cover with fluoride varnish.
Okay, gotcha.
Right. Because it would blow the silver away. We don't want that.
Okay. I have another question. There was something about killing or compromising periodontal disease. So are you saying it kills anaerobic bacteria as well then? Or has an impact on it?
Absolutely. And I just received a paper from a colleague in Texas, A&M University, where she took a group of seniors. This is a randomized controlled trial, beautifully done. And some of them got SDF, some of them got water, and they were looking at the metric of gingivitis or activity of periodontal disease. The before and afters are just astonishing.
Really?
Okay, and this is all we did is paint SDF on the teeth. Didn't treat the periodontal disease at all. Gingivitis went away. It's amazing. And so if you can figure out how to get my email, actually, I'll tell all of you my email. Okay, yeah. It's steve@nodk.com. steve@nodk.com. And
Yeah,
if you request me, I'll send that paper to you.
okay, because that's kind of weird. It must be permeating the gum tissue somehow to reach those
Killing
pockets.
the bacteria, yes. We believe that the silver does move, okay, because the saliva does attach, okay. We don't want it to obviously you want to leave it undisturbed for a while so that the silver can attach to the tooth structure. If you rinse it right away or saliva right away, dilutes it, it's going to be gone. Okay, now if it stays there over 2 or 3 weeks, the saliva seems to be moving the silver around for 2 reasons. One, the study that shows the gingivitis effect, and the prevention studies that are showing up. I mean, it's astonishing that you go in and treat cavities, come back, and they don't have new cavities, okay? We didn't treat to prevent. We just discovered the preventive effect. It's amazing.
Thank you.
Any other questions?
I have a question.
Okay.
And I'm just wondering, I know like when you put the silver diamide fluoride on and then you apply the fluoride varnish, purely like the questions we get asked when we want to bring stuff into the office is there insurance code for that? And do you bill it out as 2 separate ones?
So I don't, because it isn't worth the battle. And I would say that that has not been teased out. There is an SDF code, and there now is a SDF prevention code that has come along. Now, since the varnish is such a small component and it's so inexpensive, I don't bill for it. To me, it's not a billing issue. I just want it to be effective. Let me also say that you will hear other people are very adamant about there's no reason to put varnish on, okay? And that is because they're thinking about fluoride. And SDF has lots of fluoride in it, no question about that, okay? And adding more fluoride doesn't help in terms of fluoride. Now, you don't get anywhere near a toxic level. In fact, we're writing a big toxicity paper right now to show how safe this is. It's incredibly safe. But remember, the varnish is there to leave the treated surface undisturbed from saliva. That's why we do it.
Okay, thank you.
You bet.
So I have a quick question. What do you charge for it then?
I think that a charge for the, SDF and fluoride varnish, and again, do you charge per tooth or do you charge per quadrant? Okay, we tend to, we're a public health practice. I mean, half of my practice is private, half of it is Oregon Health Plan, Medicaid, and we're trying to do the same thing for both patients. And so we tend to look at a treatment as being a treatment of the lesions in the tooth. I don't charge per tooth. Now, there are other people that will disagree with that. I just am uncomfortable with that when I see a child with 15 cavities charging, we charge like $35, okay? And do that for every tooth because I can treat 15 teeth in 5 minutes. It's amazing.
Okay, thank you.
Sure. Please visit our mmclibrary.com and you might want to wait another month because we're getting ready to upload a whole bunch of new stuff.
I have a question for you. I really appreciated the presentation. Thank you. Are you doing more trips and do you take hygienists with you? I went to Guatemala and to Mexico and I would love to do something. We didn't do SDF at that time.
Right. Well, please send me an email and the answer is yes. Why do we do these projects? Again, it started by accident, by being invited to go to Ecuador. But we realized how much need there is in the world for this approach. And so we kind of have a strategy of figuring out how to take it everywhere. And so, you don't have to be a dentist trained in third molar surgery to do this. I mean, a wide range of people, certainly hygienists are perfectly positioned to do caries management with SDF and fluoride varnish. Okay, but this potentially could actually be used by school nurses and people like that that are trained around the world. So NODK is a medical device company that my son and I developed. He invented the device for applying, okay? And the reason we did that is so that you can treat 100 people in a morning with no electricity. And so we're kind of developing the technology to do that. And we actually have trips lined up all over the world this coming year. And we have had hygienists asked to join us, and that will certainly be an opportunity, yes.
Thank you.
Once COVID's over, I mean, that's so frustrating. Yeah. Everything is shut down, but I know that'll go away and we'll get back to work. And so what we're doing right now is really focusing on designing the clinical trials that need to be done so that we know exactly how it does what it does. Clinicians that use SDF are universally amazed. I haven't talked to a single person who says, that's terrible. In fact, the only person I've talked to that didn't like SDF was a dentist from Japan, where it was invented 50 years ago. And she just thought it's old-fashioned. Well, that's why the article that I wrote is called Back to the Future. We're coming back to that.
That was going to be another question. Is Japan still using it, or does everyone have the same attitude that the lady you were just mentioned?
I don't know if that's universally true. I would think that in Japan, all of this international literature that's bubbling up, really from what they invented, okay, has got to be raising awareness and maybe changing some attitude. I don't have any plans to go to Japan because, they've got plenty of dentists and they've got, if they want to use SDF, great. I'm more interested in going to India and to Thailand and, the other kind of places where there are no dentists and they really need help.
Yeah.
We'll see. But I have a little bottle of Saferide, the original product. I still have the bottle. But now, of course, Advantage Arrest is the product that was made in America and it is FDA approved. And I should have mentioned this earlier. It is FDA approved to market as a desensitization agent, not for caries arrest. Now, a big clinical trial is being done by Margarita Fontana in Michigan that will provide the data that the FDA will need to change it to a caries treatment designation. We're all anxiously waiting for that to happen. We don't know when it will, but then we can openly and freely say, you know, you can use this to treat tooth decay in America. Now, you can do it anyway because it's just off-label. So what? But we'd like to be able to say it's FDA approved for this particular purpose. I've never had a single parent ask me the question, is this FDA, okay, they've asked, is it FDA approved? I've said yes for sensitivity. I use it for caries. I've not had a single parent say, I don't want it, don't use it, the FDA didn't approve it. So. Anyway, so we recorded this, and I will send anyone who's interested, send me an email. As soon as we get it up on YouTube somewhere, we'll send you the link. And I'd like to encourage you to share that link within your profession, your colleagues. You know, let's get this message out as far as we can get it. You know, I'm happy to do this, but I'm more interested in getting the message out while I'm in India treating kids that need help. So getting this recording is really important.